All right. Greetings, everyone. Good evening and happy Friday. Thank you so much for joining us in another HMI interview with a professional. My name is Katie Terry, and I'm the Communications and PR Representative for the School of Global Health Management and Informatics. And I'm super glad you're all joining us today. So just a couple of housekeeping items before we get started. To our attendees, please be sure that you keep your microphones muted. We also want to make sure that you're super aware of your own protecting your personal information. We will have an open forum Q&A at the end, but it's going to be done via our chat, just so that there's no talking over anyone or anything like that, okay? Remember, this is a live event. Do your due diligence to keep your personal info protected. For students in attendance, this is a UCF event, so all student code of conduct rules and regulations apply. Now, all of the clerical items taken care of, housekeeping items. It's my pleasure to introduce today's guest, Valeria Simonetti. She's the Assistant Chief of HIMS at Miami VA Hospital System. Welcome, Valeria, and thank you so much for taking the time to be with us today. First, let's kick it off. Can you tell us a little bit about yourself and the Miami VA Hospital System?
Yes, so thank you, Katie, for that great introduction, and thank you everybody for joining us. We have a really good turnout for a Friday evening, so I am really excited about that. So a little bit about myself. My name is Valeria Simonetti, and I am a proud UCF graduate and alumni. Go Knights. So I graduated from the HIM program at UCF, and a couple of years later, I got my master's in healthcare administration, also from UCF. I would say my career started when I accepted a job working registration at Central Florida Regional Hospital for Parallon. I was there for about a year or two working registration in the emergency room before I moved on to the Orlando VA. And then at the Orlando VA, I played more of a denials management, denials specialist role. So working with claims and analyzing claims and bills to see why they weren't paid. And then after I was there for about another year or two, I moved into more of a health information HIM role at a local hospital in Titusville called Parish Medical Center. And I served as the manager of HIM there for about 4.5 years. So it is a very small HIM department. It only had about 30 people. But the benefit of working at such a small hospital was that you had your hands in many pots. So I got to really work in all areas of HIM. And then after about 4.5 years, I did move on to a bigger promotional opportunity where I accepted the assistant chief position at the Miami VA. Been there about 6 months now, and that is a much bigger facility, has about 85 FTEs. So as assistant chief, I do less of the day-to-day operations that I did in my manager role, but we still oversee many of the traditional functions of HIM, including the release of information, coding, CDI, clinical documentation improvement, scanning, the portal, the master patient index, any areas that you would traditionally associate with HIM. I've kind of have worked and dabbled in them all. So a little bit about the Miami VA. It's a much larger facility than where I previously come from. And I'm at first, and I would say I'm still adjusting. I've only been there 6 months, but it does operate quite different than a private hospital, especially when it comes to revenue cycle functions. So I thought I understood the way that money flows through the hospital, and then you get to the VA, where obviously if veterans are service connected, we can't bill their insurance. So most of our funding actually comes from Congress and the federal government, as opposed to third-party payers like it does in the private sector. So you don't see such a huge focus on the aggressively chasing the money as you would in the private sector. So I think that was the biggest change I saw from the private sector, as well as we do have a very different population of patients. So, as in a private hospital, anybody can really walk into the emergency room. So you get a variety of patients, especially here in Miami. We do, because we are in Florida, we see a lot of older veterans, and we are in Miami, so we do see a lot of Hispanic veterans as well.
I gotcha. You kind of touched on a little bit of overview of a lot of the things that I wanted to ask you about. So we'll just dive into some of those detailed stuff, okay? So first and foremost, let's talk about what is the role of the HIMS department within your organization or within a hospital system in general? You know, what's the health information management side of a hospital system?
So that's a really good question. And I get asked all the time, what is HIM? Like, what role do you play in a hospital? And that's always a fascinating conversation to have because most people have never heard of it. So you're starting from ground zero. You are literally, explain it to me like I am a child. HIM affects almost every area of the hospital, whether you realize it or not. So it starts from everything as simple as your medical records. So let's start at the very basics. So previously medical records were paper and now they've transitioned to predominantly electronic, but a lot of systems are still running on a hybrid. So half electronic, half paper. So one of the simpler functions of an HIM department is scanning all that paper that is generated throughout the hospital by our nurses, our doctors, our mid-levels, our respiratory therapists, anybody who provides patient care, as well as anybody administrative or in the financial areas of the hospital. Any paper that's produced is scanned. So that's a very simple function of HIM. If you want to get a little bit more complicated, you can get into the coding and the CDI. So obviously how money is generated in the hospital is by your billing, which is based on your coding, which is based on documentation the provider completes. So we can do, when you look at revenue within HIM, it can touch every aspect of the revenue. So everything from looking at our CDIs who look at the documentation that our providers are producing and doing a thorough analysis, reviewing and seeing how we can improve our documentation so we can receive a higher reimbursement from our payers. That's one aspect of HIM. We also have data analytics. So all of that information that is entered into the electronic medical record, the EMR, every click produces data. So every piece of information that a provider enters on a patient generates data. It goes into the computer and then we can run reports on that. And it tells us we can learn more about patients based on what we collect in the EMR. So for example, you can, if you think that you're underserving certain populations in the emergency room, for example, diabetic patients, you can run the diagnosis codes by patient. So you can generate a list of diagnoses by patient, and then you can see what type of insulin they are. So you can do comparison analysis of what type of diabetes and the demographics of certain patients and compare it to the type of insulin they are, and then draw conclusions. So really, HIM affects every area of the hospital that you're in. Those are just a couple of examples. We can dive deeper.
Well, so okay, let's move on from there, right? So, we're talking about all of the aspects that, HIM talks about in the hospital. So what does your day-to-day look like? So when it comes down to all of this, what is the assistant chief doing in the HIMS department?
So as the assistant chief of an HIM department, my job is to support my supervisors and my managers and make sure that everything is functioning correctly. So there's a couple of different pieces to that. The first one is the HR portion of it. So we have such a high, we have a large staff, and maintaining that staff, there's a lot of HR manpower that goes into that. So to give you an example, right now, we're really struggling to recruit some of our entry-level positions. And that's not just us, that's obviously across the industry. We're seeing, the country has very high levels of unemployment. We can't fill our positions. So we're having to be very creative with how we fill these positions. So I spent a lot of time this week actually looking at how we can recruit and retain. So I spent a lot of time with HR asking how we can, can we get incentive bonuses? Can we get, do we have job fairs we can attend? Since we are the federal government, we operate by different rules in the private sector. So my idea of just reaching out to a job board, a job, posting online and posting our positions isn't necessarily as easy as you think it would be. So that actually filling our positions, interviewing, meeting with employees, resolving labor issues, those types of things require a lot of manpower, especially right now we're dealing with, we're trying to track down all of our employees and make sure that they're COVID vaccinated. And believe it or not, that takes a lot. Even though we only have 82 people, that requires a lot of intensive. So that's the HR portion of it. I also do a lot of issues escalation. So we do have our team of supervisors. So example, if a patient is unsatisfied with their bill, they might not like the way that their bill was coded. So we receive, if the supervisor can't handle it, that's when I would step in and try to mediate between what we see with the patient and the code and the billing department. Same thing with release of information. We do a lot of issue escalation there. So if a patient comes into the hospital and requests a copy of their medical records, a lot of times people just think that they can just walk in and receive a copy of their records. That's not necessarily the case. We do have to abide by HIPAA and other state regulations, so we can't always hand out your copy of your records, and patients seem to be a lot of times under that impression. So when issues like that escalate at the VA, we do have a lot of mental health issues. We do have a psychiatric unit, a lot of sensitive information. So a lot of the times we don't always have the availability to just release that back to the patient. It has to be reviewed by the physician before we can release it. So a lot of mediation issues with that. I also supervise registration in patient scheduling. So any issues that can't be resolved with scheduling are usually escalated to me. So I do a lot of what the supervisors can't handle, or their hands are crossed, they need to bring to their supervisor. I do a lot of that. We also do a lot of strategic, where do we want to see our department in short term, 6 months, and long term, 2 to 5 years down the line. So we're currently in the process of doing our performance evaluations for the fiscal year. And we're really right now evaluating each of our positions. What do we expect from them in a quantifiable and measurable way, so that in 2 to 5 years, we can have a staff that has the appropriate education, the appropriate experience. We do a lot of succession planning. We have a mentorship program. So we mentor not just, it's open to the people in HIMS, but it's also open to other administrative areas. So if you're interested in joining the mentorship program, you can do that. And then I spend some time, each of our managers in our department spend some time mentoring, and then we identify, this is an employee who has goals. How can we, over the next 1 to 2 years, help them achieve these goals? Like they say they want to move up in their positions. Let's look, do we have anybody who we know is retiring or is interested in moving on or is interested in promotion? And that's how we move people to areas that are better suited. We coach them and those types of things. So it's really all over the place. I know at the beginning of the pandemic, we had an issue with, we had all of our results were coming in paper, and we had to report them to the Department of Health. And it was literally a stack as tall as I was of results that needed to be actually paper facts. So it was organizing, was getting the secretaries together, was getting infection prevention. So it's a lot of crises that occur. I also, throughout COVID, I screened. I stood at a door and I took your temperature and I asked you the questions. I have cleaned out storage units full of old medical records. So I have done it all. It's really just a day, whatever emergency pops up that day, dealing with.
You're actually in a really unique position. As you had mentioned earlier, you did the undergraduate in the health informatics and information management, and then you went back for the Master of Health Administration. And what a lot of people don't realize is those are actually two different factions within the healthcare industry. So can you tell us what made you take that route where you've gone from just working in the health informatics side to where now you're building in that health administration combined with the health informatics?
So when I was deciding on a master's, I wasn't really sure which direction to take because there's a lot of good master's programs and degrees that you could choose to pursue if you wanted to. But I think at the point where I was when I was making that decision, I knew I really wanted to go into management, which is why I ended up in the healthcare administration. And I thought that was a really good complement to the skills that I learned in HIM. So while I was working on my HIM degree, we learned a lot of the basics, like we took the accounting classes and the coding classes, the human resources, organizational management, economics, and then all of that was built upon in your MHA. So you were learning it at a more specialized level where it gave you the foundation where when you go out into the real world, you have all of that, the theory behind it. So all you have to do is apply it. And I thought that was really beneficial. Gaining that knowledge in the classroom and then being able to apply it in the real world, especially when it came to a lot of the organizational management and human resources. That is very theory-based and it's very much applicable to what you do in the workplace. But, HIM was great for giving me that foundation, but the MHA really allows you to take that step into management and to go higher level in your career. And that's really what I was looking for. And that's why I decided to pursue that path.
And here you are, working as the assistant chief, and you're doing exactly that. Like you said, taking on the HR aspect, et cetera. So what would you say is the biggest difference between the two subsets, right? So not necessarily the master's level, just in general, like on the side of the health administration versus the side of the health informatics and information management, what would you say is the biggest difference that you've seen?
The HIM side is very technical. It's very nitty gritty. The devil's in the details. The HIM is very detail oriented in every aspect of it, whether you're scanning records and you need to ensure that everything files into the correct patient, into the correct visit, whether you're working in release of information and you have to make sure that you are properly reviewing the patient's chart and the request to make sure you're only releasing what you're legally allowed to release or the minimum necessary or what the patient requested, or while you're coding and you're reviewing the documentation in the medical record, there's hundreds of thousands of medical record codes of ICD codes. So you have to make sure that you are picking the right one based on your documentation. So every aspect of HIM is very detail oriented. Whereas in health administration, I feel it's a lot more broad. Like I said, you're learning a lot more theory and how to handle different situations. It's teaching you that critical thinking of how you deal with different situations.
I gotcha. In my just opinion, it's almost like having done both sides of it, you now are able to go across the board with it because you've got that detailed information in practice, plus the theory of the health administration. So now you've got this very broad view of both of them when it comes to healthcare. So that's awesome. So, staying on the health information side, what would you say is the most challenging thing facing health information management professionals right now?
Ooh, that's a good question. Honestly, and I'm looking at Dr. Noblin, we have such a hard time recruiting HIM professionals. We just don't see enough graduates who are interested in pursuing the operational aspect of it. We always have a lot of people going into the coding or who are interested in going into the coding and the CDI, but we don't have a lot of students who have always expressed an interest in the operational and the management aspect. And there's so much more to health information management than the coding piece of it. So we're really struggling to find good RHIT, RHIA candidates. And that was not just here at the VA, but when I was at Parrish as well. I mean, there's positions that stay open for years sometimes. So with that being said, that's why I'm so excited. There's so many people on the call. There's so many people we can reach out to try to recruit into HIM, because I do see that as barriers where there's not, I personally don't feel there's enough HIM students entering the field where we can supply all of our jobs. And I feel like there is plenty of potential and growth in HIM. We're just
struggling. Going back to it, there's a lot of alphabet soup when it comes to health informatics and information management. But let's talk about the RHIA and the RHIT. Can you just spell it out for everybody? What is RHIA and why is it so significant to that operational side? What really helps a graduate be able to take that and then get recruited with an organization like yours?
So the RHIA and the RHIT, and Dr. Nalvin can correct me if I mess up the abbreviations: Registered Health Information Administrator and Registered Health Information Technician. And that is the credential you receive after you do either your 2-year associate degree and you receive your RHIT, or your 4-year bachelor's degree and you receive your bachelor's degree. So it's basically a credential that attests to your proficiency and your knowledge in the HIM industry. And for a lot of reputable employers, so if you want to work for a major hospital or a major employer in an HIM position, they do require the RHIT or an RHIA. And that makes you competitive. So it's basically, once you finish your degree, for the most part, you are eligible to sit for the exam, attest to your knowledge, and then you're awarded if you pass, and then you can put that on your resume, you can have your credential, and then that will make you much more employable in the field.
Yeah, I do know that our program offers a lot of training and help to prepare students for the RHIA. That's a lot of our students that have graduated from the program end up getting their RHIA, and we definitely encourage that for all of them. So, just a minute ago, you were talking about a lot of people wanting to go into the coding aspect of it versus the operational, and that's where you really need it. But what are the other aspects, the operational aspects that you're talking about? What are some specifics there?
So, like I mentioned earlier, you can do the scanning. There's release of information, there's patient portal, there's the master patient index, Yes, there's a lot of, there's the data analytics portion of it. There's chart analysis. So there's definitely a lot of different areas in the operational aspect of it. I think coding gets a lot of attention because it does affect the revenue of the facility. And that's obviously something that, as payers continue to deny and reduce reimbursement, we're obviously focusing a lot on the revenue aspect of it. But on a practical aspect, a lot of these revenue positions can be work from home and done remotely. So, that's kind of the way the future is going. And that's why we see a lot, I think, of especially people who would like who have families or who want to go back to school, are interested in these positions because it's flexible with your work-life balance. And that's one of the strategic areas that we're focusing on in my position right now is how can we take some of our operational jobs on the operational side of the house and make them more telework friendly. So how can what systems, what softwares do we need in place in order to maybe send some of these people home, if not full-time, on a part-time basis, so that can make us more competitive to other employers. So against, for other candidates, release of information is something that contractors for a long time have been doing remotely. And for the most part, hospitals still traditionally have their release of information, their ROI staff on site. So what models can we copy from contractors and implement here in a hospital where we can hopefully maybe send some people home? So they're, especially in a time of COVID, we don't have all the patient interactions, and we do have the technology to do that. It's a lot of it is designing the systems and then getting leadership buy-in. So you have to get your executive leadership on board with, sending these people home, like especially in traditional hospital environments where there's a reluctancy to adopt those modern practices of telework.
Yeah, for sure. I mean, that's been seen across the board since the pandemic has hit us. There's article after article about the entire face of employment changing, just the way that we operate for the pandemic, and speaking to that point of the pandemic, what has been kind of the biggest challenge for health information management professionals with the pandemic? How have you guys faced some of the challenges that have occurred?
Let's see. A lot of the things we have already touched on. It's presenting challenges in the staffing. There was a time where the administration said send everybody home, and then we sent everybody home, and then we're trying to figure out how to do our jobs. And then a couple of weeks later, we weren't prepared for it at that time. Now, a year and a half going into 2 years later, we're in a much stronger position, so we can start putting some of these plans together. So it has affected staffing. One of the other things that we have seen a lot is the vaccine tracking. So believe it or not, actually, I don't think it's that shocking. People are losing their vaccine cards. And we received very strict rules. At the private hospital I was before, the rules were very strict about you can't reproduce a card. So we were really working on ways where, how can we build this, for example, into our patient portal? So if you receive the vaccine here at our hospital, let's build this into the portal so the patient can pull it up on their phone or their computer. And if they need that proof of vaccination, it's easily accessible to prove it to somebody. We had to figure out how to build it into our EMR or how to make it communicate. So if you didn't get your vaccine with us, how do we prove the validity of the documentation that you have provided us with? And how do we build it into our system without taking ownership of it? So that even if you didn't get your vaccine here, it's still in your record history. So in 5 years, when you come in and you need all of your vaccine history, not just your COVID vaccine, that it's included in that together. So you have a comprehensive view of your whole medical history. So lots of challenges with how are we going to build this into the systems we already have. We had some coding issues earlier in the year. At the very start of COVID, there obviously wasn't a diagnosis code for COVID. So that presented a lot of issues as well. With, there were patients who specifically wanted certain codes listed on their claims because if it was coded a certain way, it would be free because it was COVID related. So that presented a lot of issues for us at the beginning with, how do we code this so we're maintaining the integrity of the treatment that is being received and the documentation that is being entered into the chart. So definitely lots of little nuances here and there that with time we have gotten much better at. Now we have a state registry. I mean, we've always had a state registry for vaccines, but that's built in now. We have codes, so we know, and we've received guidance and coding clinics on how to code appropriately for COVID. We're still struggling with staffing, but with time, some of these issues have resolved. And I know for the future, we're going to have lasting effects, and we've learned a lot of lessons along the way. So,
yeah. So, going back to, you had mentioned, being a government entity, there's a lot more red tape and bureaucracy that you end up having to go through. Whereas, one of the private hospitals, they're like, hey, we need this EMR system so that we can have these people. But you guys, you have to go through the specific steps because of the funding, right? Mm-hmm. So I guess I have two curiosities here when it comes to that. One, what kind of EMR system are you guys using currently, like Epic, Greenway, Cerner, those types of things? Or do you guys already have one built within? And two, what's the process for getting new systems implemented so that you can, start recruiting and have people work remotely?
So to answer your first question, we currently operate on Vista. And Vista is the original EMR. It's probably been around since the 80s. And we're still operating on it. So we are planning on updating, I believe it's to Cerner. Miami was already supposed to be on Cerner, and then COVID happened. And now we're 2 years behind on the schedule. And then they said that there's a new schedule. So now we don't know where we are on the schedule. But, an implementation that might take a hospital, a private hospital, probably 1 to 2 years. I mean, the VA has been trying to roll out Cerner to match the DoD for years now. Like, this is multiple years. And you have to think, a private hospital makes a decision for 1 or 2 hospitals. Like maybe Advent Health has maybe 30, 40 hospitals they have to make a decision on. The VA has to make a decision that fits for every VA across the country. In addition, they're trying to be compatible with our sister organization at the Department of Defense. So they picked a software that, provides the whole continuity of care for a veteran. So when they are actively serving and they're receiving their care through the Department of Defense, all of their records are produced in or maintained in Cerner. And then once they leave active duty and they become a veteran, that all of their VA records will also live on Cerner. So it'll be an easier transition because trying to transition information and data between 2 different EMRs is a nightmare. That's a whole separate conversation. So the idea is if we're both on Cerner, that, throughout the life cycle of a veteran or a soldier to a veteran, that all of their information will be in one place and it'll be easy to access from every point of care. And that's particularly important to our veterans because obviously they go on and a lot of them will go on and get their GI Bill and Social Security and disability and housing benefits. They get all sorts of benefits after they leave the service. And a lot of times they need medical records for that. And they need to be able to pull from both their active and their veteran status. So that's why it's important for both agencies to be on the same EMR. But like I said, you're rolling this out to hundreds of hospitals and clinics because, we have a hospital and then I think Miami has like 16 clinics, all the way from West Palm Beach to Key West. So it covers a wide range. So it's not just every VA hospital, it's every VA hospital and its clinics and its child clinics. So it's a lot of veterans and it's a lot of hospitals. And that is naturally going to take longer when you're trying to make a decision that best suits everybody. But there's a lot more emphasis, like you mentioned, on financial responsibility because we are all liable and responsible to the taxpayer and the funding that comes from Congress. So you see a lot more scrutiny when it comes to our purchases. At my private hospital, I could just talk to somebody in finance, they would scan their credit card and bam, we would have whatever supply purchase we needed. It was there within the week. It was a very different process now. If you want to purchase something, there's usually an application process depending on what you want to purchase. It's like 5 to 10 pages that you have to complete. A lot of the times you have to complete like an RFO, or you have to look at several vendors. You can't just, this is the company that we want to go with, this is the vendor that we want to go with, this is our decision. You have to have an open period where all the vendors and contractors can submit their applications. We have to review, and then we can select a contract. Then you have to do your proposal, and then many people have to approve it. So, and again, like to give you an example, we recently had to buy CD burners for our release of information department. So they burn radiology images onto a CD, and then veterans can take those CDs to other hospitals in case they want to see their images, for pre-surgical clearance, for attorneys, Social Security, literally anything that they need those images. Some people just want them to keep them and review them and keep their own personal health record, which is always great and encouraged. But so we bought these machines, and the CD burners could be selected at the local level. So we could buy whichever CD burner we determined was appropriate, that was compatible with Vista and our other softwares. So we purchased this, like the physical hardware, and then the software that has to be installed onto the hardware, we're having trouble getting approved by the national IT office. So locally, IT told us, yes, IT can buy our hardware, but the software now has to be approved by the national level, because for security purposes, they obviously want very strict standards across the board. So that's just one of the red tapes you mentioned earlier that you would run into. So just when you have the local level, then you have like the regional level, then you have the national level, and there's different criteria at every level. You don't always know what you're going to run into. And I completely forgot your second question.
No, that's totally fine. I mean, we'll get to my second question because actually Dr. Noblin chimed in there for when we go to the open forum. But, you know, it's just a great perspective to give. You know, a lot of students don't realize that you will have two different things to consider, you know, when you're going into, if you're going to work in healthcare, you know, health informatics, and you want to go into a hospital system, there is a huge difference between a private hospital system and a government entity hospital system like the VA. So it's super awesome for you to give us that like perspective. Working in the public sector myself, I understand exactly what you're talking about. But those working in the private, they're like, what do you mean you couldn't just purchase the software? But it's a whole system. But the second question was, I think you did answer the second question, because I did ask you about the red tape and which system you guys were going to. And Dr. Noblin chimed in with if there were any updates on if you guys were going to go into and what the differences between the EHR systems that you've worked on, via the difference between the two. So like what would be the difference between what you worked at the private hospital system at Parrish versus the Vista, which is from the 1980s?
So the first part of the question, based on the pre-COVID schedule, we're supposed to be on Cerner by the end of 2022. So within the year, I guess a year and a couple of months, we're supposed to be on the system. I doubt that happens. I know they said that they were going to provide us with a new update. So we don't know what schedule we are on yet, but we haven't seen, at least at our facility, HIM doing any implementation preparation for the implementation yet. And that's because, like I said, everything was paused throughout COVID. And what's interesting is that you do have other VA hospitals that have transitioned to Cerner, and you get to listen to them brag about how great it is. So while we struggle, we're almost there. We haven't really started the planning phases, at least at our facility, unless it's going on really behind the scenes. We haven't started that aspect of it yet. I think the issue or the biggest difference that we're going to see is that Vista, for the most part, is a repository. So it just displays the information. It doesn't have a lot of the intelligent features that a lot of our EMRs that you see, like Cerner and Epic and Allscripts and Athena, have. So for example, our patient portal isn't necessarily connected to our Vista. So that information has to go through a completely different software before we update it. One thing that I'm really a proponent of, that I am trying to push at our department, is getting electronic fax. So at my previous facility, our fax was smart enough so that when we received a fax from an outside facility, we faxed it in, it went into the chart, and then somebody on the HIM team would review it and say yay or nay. Like, yes, this is good to go into the chart, nay, it can't go into the chart. So, for example, that's one of the features I would be excited about if Cerner has, is that ability to receive outside information and place it into the chart without having to scan it in. I mean, some of these other EMRs are so advanced, like you can take a picture of it on your phone and it goes into the chart. And with Vista, you can't do that. And my other facility, you had the doctor take a picture of the prescription, and all the prescription information would auto-populate into the chart based on a barcode. we don't see some of that information. I'd also like to see more interoperability with Dragon, like speech recognition. So just a lot more features of an EMR that has more functionality.
Yeah, for sure. I hear interoperability a lot. We need a whole webinar just on interoperability. We're not even going to jump into that one today. So one more question for me before I open up to the rest of the attendees. Just to our attendees, we're going to jump into the open forum here in a second. So please utilize the chat function, type in your question, and I'll go ahead and announce it to Valeria to answer. But let's rewind back to you're finishing college and all of that. What is something that you wish you had known about the industry that you didn't when you were graduating, when you were finishing your degrees?
That's a good question. I didn't know what a wide field HIM was. And there's so many areas that you could go into. So when I had my degree and I was looking for a job, I kind of just picked the job, what was available, who would hire me. And then I kind of stayed on that track. Like I started in registration and then I moved into claims and denials. And that was kind of where my progression was taking me based on, the fact that somebody gave me a job at one point. So as students, I would really encourage you to understand all areas of the industry because there's lots of options and variety and diversity out there. So don't limit yourself into a box of what you think HIM can do because an HIM degree is a very versatile degree. I've seen HIM in not just HIM, I've seen them in compliance, I've seen in finance, I've seen in high levels of management, executive management. So really go into this with an open mind. You can use your HIM degree for a variety of different areas within healthcare.
Speaking to basically advice for what they're doing, what would you say are like the top 3 skills that students should refine trying to go in there? You're looking to recruit into your HIM, so what would be the top 3 skills that they could refine while they're finishing their degree?
Hard skills or soft skills?
Just the top 3, whether it's hard skills or soft skills, but like the ones that are, very specific.
So if you're going into HIM, I would definitely, depending on which area, you're interested in as a student, is know what you're expected to know when you finish your degree. So if you want to go into HIM, that's know your HIPAA, both the privacy and the security aspect of it. If you want to go into coding, know your coding guidelines, like dominate that technical aspect, that knowledge, and those skills, because that's what's going to set you apart. Like at the end of the day, if you compare all of your applicants and all of you have 0 real world work experience, and you're only answering questions based off of your education, it's going to stand out who actually put the effort into knowing and mastering the educational aspect of it and who kind of just skated through. So really know what HIM is and the technical aspect of it. If you have no experience, more on the softer skills, I would say your communication and your follow through. So if you say that you're going to do something, do it. Don't make promises you can't keep. If you say to your boss, I'm going to have this to you by this date, have it to them by this date, or provide a justification as to why it's not done. I feel like that for me really separates our entry levels and our new hires from the ones who are professional for the ones who are still in student mode. Like you can tell who's already in the I'm in a workplace mindset because they follow through, they keep their commitments, they ask questions when it's appropriate. So really keep in mind your professionalism when you're starting in a new workplace, because that really stands out as people who are ready to work and people who are still, like I said, in the student mindset. The third one is, again, a soft skill, and those who are willing to open up to new experiences. Like even if you accept one position and you think you're going to be doing responsibility A, B, and C as listed on your job description, really be open-minded If your supervisor assigns you different work, feel free to take that on. Ask what new responsibilities you can learn, because that's the best way you're going to get experience. So, at the end of the day, if you only do your job, you're only going to know your job. If you take on new responsibilities, you're picking up new skills that are more transferable. So if one day it comes, to where you have to apply for a new job, you can say, this was my position, but I also did X, Y, Z, and that makes me a stronger candidate. Also, I would just say, always update your resume. Always keep it updated. As you take on new responsibilities at work, or you take on projects, anything of the sort, keep a running list on your resume, because you never know when the next opportunity is going to come, and you want to be ready for it.
That's great advice. I mean, resumes are a big one that we try to insist upon for our students. So talking to the students who are interested in the RHIA certification and getting that, what would be your recommendation to them as far as, preparing for the exam, taking the exam, and what's going to be the biggest benefit to them getting that?
I would say the biggest tip for sitting for your certification is do it as soon as possible after you graduate, because when hiring, we've seen experienced professionals who either never got their RHIA or they let it lapse because they didn't see the value in it. And like I said, to be competitive in the industry now, you're expected to be certified. So a lot of the times they're interviewing for a job because their employer said, we're now requiring you to have the certification, and now they're struggling to pass the certification, and then they're looking for new employment. I've seen that quite a few times now. So get it as a recent graduate and maintain it. Do your CEUs. Don't let it lapse, because the more time you go on, the harder it gets. As for the biggest benefit, I think, like I mentioned earlier, you really, in order to be a competitive HIM professional and to work for a good employer, to have a good salary and good benefits, the RHIA is beneficial.
Yeah, thanks so much for letting our students know that. I like to remind our students, we do training for that. We prepare you for that. Talk to your program director, because we are more than happy to help you get that. As we've got an assistant chief of HIMS recommending to you to go ahead and do it. So I guess the last question we'll give you today, Valeria, you were talking about recruitment. If we've got students who are interested, how can they go and find out how to start working with you and getting into the field? What's the best way to go about it?
So if they are willing to relocate to Miami, we'll take them. So any jobs are posted on USA Jobs. You can set up your alerts. It's super helpful. I also try to encourage my supervisors to email out the links to the local schools and any networks they have in the area, for any positions that I know require an RHIA. I try to email Dr. Noblin's program assistant, maybe. I
forgot. we have a program coordinator, and we have our intern
program coordinator.
Yeah. So
yes. Yeah. And I forgot her name, but we try to email her. I think we emailed her our CDI one a couple of months ago. So I always try to, I know I've been making lots of new contacts with the program directors here in South Florida. So I'm always pushing that out. If there's something that is RHIA required, I will send it to the program coordinator so she can distribute that to the UCF, because I definitely want to hire a night. I have no problems with that. And we have the vacancies. So, but we send out those links. And then just shoot me an email afterwards saying, hey, I applied, so I can keep my name out. The thing about hiring federal is everybody is qualified by HR to reduce bias, and nepotism. So you do have to meet all the basic requirements of the position. That's determined by HR. Hiring managers don't have anything to do with that. So if you can get through HR, then your name and your resume makes it to me.
Thank you
So.
for telling us that. And it's Thea Samaki is our program coordinator for the HIAM program. Yes. And we do send out to our students whenever we get it from you or our other partners and that type of thing. Anyways, Valeria, thank you so much for joining us today. There was so much great information. I tell Dr. Noblin and the other program directors all the time, I have these interviews with some of our alumni and our partners that are working in the industry. And I literally learn something new every single time. Every single time. I think I've heard it all, but I learned something new every single time. And I really hope that our students and our audience does too. So thank you again for joining us. It was so great to have you here. Thank you to our attendees. And we will definitely see you at our next webinar.
Thank you. Thank you for having me.
Yeah, everyone have a great weekend.